Yes. And I think the last or the second last maybe point that we need to keep in mind is the antihypertensive drugs to be used in chronic kidney disease patients. So in CKD patients who are not on any dialysis, right, they are likely to have proteinuria, and so using A's or ARBs are the best as a first line agents in these patients. When they undergo dialysis, beta blockers are the first line drugs preferred for patients with CKD. Another important issue that you may have to keep in mind while treating hypertensive patients is compliance, as happened in the present problem also. They become non-compliant after some time. They stop taking the drug at the prescribed dose. They stop doing the non-pharmacological measures. Their BP shoots up, right? And then you need to take utmost precautions so that the patient are adhering to the prescribed therapy. So as physicians, you need to detail them. You need to spend hours together in explaining them what is the risk of having uncontrolled blood pressure, what are the benefits that you will have by using such antihypertensive drugs, show them videos, show them some good materials in decoding in layman's perspective, and coordinate with other staff nurses, pharmacists, counselors, so that the patient clearly understands the importance of taking antihypertensive drugs. And for patients, you can also suggest them to use self-monitoring device. Now it is just 5 dinar. A BP monitoring device at home is just 5 dinars, right? So they could have it at home. They could monitor their blood pressure, because that reinforces their intention to take the drug. If my blood pressure is under control, I would feel, oh yeah, my drug is working out very well. So I used to adhere to whatever you have prescribed to me. So suggest them to use the reminders, involve their family, give them some positive reinforcement so that they are adherent. And as far as the treatment is concerned, prefer to keep it as simple as possible. Just give it once a day, a longer acting one, and if you are giving them multiple antihypertensive drugs, see if you could give it them as a combination pill. So these are some of the strategies with which you could improve their compliance. And last, you should also keep in mind about the circadian changes that happens with the blood pressure. Any biological parameter activity will have circadian. Let's assume this is the 12 midnight, and let's assume this is 11 p.m. on the next day, right? Any activity will undergo variation, right? When it undergoes variation in one day, we call it circadian rhythm, 24 hours, at a duration of 24 hours. So blood pressure, if you see, it is not at the same activity throughout day and night. The blood pressure increases, heart rate increases, the vascular resistance increases, the renin activity increases. Everything is more between 6 o'clock and 12 o'clock. 6 o'clock and 12 o'clock. So you need to ensure that the patient has adequate anti-hypertensive effect between 6 a.m. and 12 noon. So the drug that you are prescribing has to be there in the patient's circulation at this time. Only then it can effectively control the blood pressure. So you need to keep this point in mind. And the last is the non-pharmacological measures. So you must be knowing all this. So along with the drugs, if you have to suggest the non-pharmacological measures, and they again improve the control on blood pressure. As always, if you have any questions, these are my coordinates. Please feel free to contact me. And this is the answer for the last session that we had it on rheumatic heart disease, right? And yes, one more correction I want you to note is on the 10th MCQ on the first session, congestive cardiac failure, right? The question was, which of the following drugs at low doses is likely to produce dilation of renal vasculature without acting on the heart? I think there was an error in the key. It was the option was, the right answer was given as B, which is wrong. It has to be C, because digoxin, even at low doses, it acts on the heart. So without acting on the heart, it is dopamine at low doses. So the correct answer for this question is C. Just make this change in the key. And again, I have provided few more MCQs on this. Do it after you complete your reading, and then I'll provide you the answers next week in the next resource session. If you have any queries, clarifications, feel free to let me know. Thank you and take care.